will, thank you, everybody. We will call our meeting, public safety meeting to order. Can I get a motion to approve our minutes?
So moved.
Second.
We have a motion and a second. All in favor of approving the minutes, say aye.
Aye.
And opposed? Minutes are approved. Okay, in the packet, there is an update from the police ombudsman. There's a sit-lie written report, strategic initiatives update, and a photo red update. I like to say that because folks are at home and may not realize that they can take a look at that. And then we'll just get into it. So our first item is an update from Chief Meidel. Chief? And then just FYI, we are actually removing number 12. 911 is not able, Shrek is not able to be here today, but we are trying very, very hard to make sure they're here in February.
So can I just respond to that? I want to just publicly make sure that we have a request out to them that they come in February and give us a report, because we have been asking for that for a while.
Yeah.
And I think that it's overdue, and it would be great information to have.
We tried to get them here in April. There were scheduling issues. We've been kind of bouncing back and forth, but we are adamant about
Yep,
getting
I
them.
appreciate that.
Yeah.
Thank you.
Councilmember Cathcart, would it be possible to wait on the recruiting and retirement update until Council President is here? 'Cause
Oh.
He specifically wanted that info.
That would be fine. Chief, do you mind holding off just a minute? And we can actually turn it over then to Kevin Berry, and he can do the update on the property facility.
Hi, my name is Kevin Berry. I'm the evidence supervisor for the Spokane Police Department. The city administrator asked me to be here today to present the video that we published last week.
I'll go ahead and pull that up here.
It's about a 3-minute video. If you guys have questions afterwards, certainly feel
Can
free
you
to
actually
ask.
pull it up, Shay? Because I don't have a keyboard to control click. If you just open it, I can take care of the WebEx piece. Okay, I got it. Thank you.
It looks like a used car lot, only the vehicles here all have something atypical in common, a criminal nexus. This is the vehicle storage area of the Spokane Police Department's property and evidence facility. Hundreds of vehicles with hundreds of stories are kept here, while criminal cases are investigated and adjudicated.
Most of what you see along the walls are all major crimes, so robberies, homicides, and assaults. Most of what you see down the middle are typically drug cases.
Kevin Berry is SPD's evidence supervisor. He knows the stories behind many of these vehicles that were somehow involved in a crime. Like this car from a 2006 homicide case. Until just recently, it was the oldest vehicle in storage, 16 years. Since investigations and court proceedings can take years and years, most of these vehicles spend a good portion of their lives here. Cars and trucks are constantly moved around as cases are closed or advanced, or vehicles from new cases are brought in. But how to move them without getting inside? Because these vehicles are evidence and contain evidence that can't be tampered with or touched. Enter the Stringo. The city of Spokane purchased the vehicle mover 10 years ago, so property didn't have to rely on tow trucks to move metal. The Stringo paid for itself in 3 years and has since saved the city, taxpayers, more than $300,000 in tow bills while moving well over 5,000 vehicles.
It's like a big game of Tetris, I guess you could say. So where there's a space, we can get vehicles into pretty tightly. Space is obviously an issue, as you can see. We are over capacity for what we would like it to be, as far as maneuverability and ease of use.
This year, Spokane Police property has taken in more vehicles than it can release. An increase in major crimes cases, including a significant rise in vehicular homicide and vehicular assault, is part of the reason. The increase means the Stringo is even more critical to property operations. In 2012, when SPD began using the Stringo, it was the only unit west of the Mississippi. Today, law enforcement agencies from around the region have traveled to Spokane to test drive SPD's Stringo. The end of the road here is to wrap up cases, clear vehicles, and return them to their owners or otherwise dispose of them. But in the meantime, Kevin and his team drive the Stringo, moving cars and trucks in and out and around, vehicles that, like all items at the police property facility, have stories, crimes, tragedies attached to them.
Same with a vehicle, it's just an item. Something bad happened in it or around it, but we don't dwell on that. It's a rewarding position to be able to find, stolen items, stolen guns, computers, things like that, that maybe somebody else hasn't found, and be able to return those to the rightful owner.
Julie Humphreys for the Spokane Police Department.
Are there any follow-up questions regarding that?
Yeah, thanks for being here. I guess what I'm wondering is, and feel free, anybody, if you have questions or comments, what's the plan going forward? Because obviously we are limited in space, and we're able to play Tetris today and make some things work. But as you mentioned, this year we've seen an increase. And I assume, we're probably not going to see a major decrease anytime soon or a major change like that. So what's just the plan going forward to make sure that we can continue to house the evidence?
My chain of commands has definitely been looking at other options as far as off-space storage. That's still a work in progress. Money's available and things like that. Long-term plan, there's a lot next door to us. We're hoping that the owner will eventually someday want to sell that to us. But yeah, we continue to explore other avenues of where we could store cars off-site.
Is there cooperation with the county or any other jurisdictions in terms of working together on this?
While we are a joint use facility currently, we actually only store city vehicles. So all the vehicles that are in that video, those are only city cases only. That would be a nice long-term option. It would be to fold in the county vehicles as well.
Yeah, okay, very good. Are there any other questions from anybody else or thoughts?
I'm glad I know what Stringo is now.
It's a very useful tool.
I saw that on the agenda, and thank you. That's a good presentation.
I might want to come out and check that out in person, so I might
Yeah, if
be in
you guys
contact,
have
so.
never been to the facility, I encourage you to come out, take a tour. That's only one of 3 parts of the warehouse. It's, an interesting place to come take a look.
I've been in a different part of the warehouse, but not in there, so.
Thank you.
Yeah. Okay, we still don't have the council president, so we will hold off for the moment on our police department update.
Councilmember Cathcart, I just got a text from him that he will not be able to make it.
Oh,
so
okay, all right, well,
I can direct him to the video to
Perfect.
check it out later.
Chief Meidel, if you'd like to share, and then we'll have Chief Schaefer after.
Excellent. Thank you. So as Chair Cathcart, members of the council, thank you very much. Craig Meidel, Spokane Police Department. So I was asked to go over our recruiting and retention numbers and wanted to hit some of the highlights real quick. So when you're looking at our recruiting efforts year to date, 2022 compared to 2021, we had 548 applicants this year compared to 487 last year. Now, when you hear 548, that sounds like a great number, and that is a good number. But when you look at the ratio of how many apply that we actually hire, we hire about 1 out of every 10 to 12 that apply. And when it comes to laterals, it's usually about 1 out of 2 to 3 laterals that apply that we actually hire. When you're looking at the number of candidates who are people of color, from 2021 to 2022, we have seen an increase of 23% from last year as it relates to diversifying those who have checked the box for Spokane Police. We've seen a 31% increase in our Hispanic and Latino applicants from 2021 to 2022. So we went from 57 last year to 83 this year, thus far this year. Then a 24% increase in multiracial applicants. And again, so that was 38 in January of last year, 50 now, so a 24% increase. Those numbers are trending in the right direction. If you go back to 2019, we had a total of 28 females apply for the Spokane Police Department. Thus far this year, we've had 56 apply. So going back 3 years, we've had a 100% increase in the number of females that have applied. And then when we look at African-American applicants, we stayed the same this year compared to last year of 27, but when you go back to 2019, we had 4 African-American applicants apply in 2019. We're consistently at 27 as well, so we've seen a great increase there. Before I close on the recruiting, I just want to give accolades to Director McConnell, Lieutenant Wool, and the recruiting team they put together. There was a WASPIC grant that she came in front of the council and requested to be able to receive money. So with minimal cost to the city of Spokane, we've been able to see some significant increases in those numbers as well.
Just a quick question. So I know this is recruiting and people that are applying, but what about, do we have numbers on how many out of those communities are hired?
So hired for Spokane PD.
Yeah.
So yeah, we typically have 2 academies a year. It's called BLEA, Basic Law Enforcement Academies. So we've typically had 2 each year. We filled those 10 slots that were given. So 20 new hires per year. 2023 is kind of an anomaly for us. We're actually being given funding for a 3rd BLEA, so we should ideally have 30 spots that we can fill this year. There's a caveat, and that leads to my next section, though,
Okay.
which is, so when we head into January, the January Academy, we're allotted 10 slots for every single academy, and that's because we provide the bulk of the staffing for hosting the academy as well. So we're guaranteed 10 spots for every single academy. This is the first time since we can remember we're only going to be able to fill 6 of those spots for this academy, and a lot of it has to do with what we're seeing in every profession, just a lot of attrition, a lot of vacancies. Not sure where all the people disappeared to, but we're only going to be able to fill, it looks like right now, 6 of our 10 positions for the January Academy. We'll have another academy in May. We hope to get 10 in that academy. Not sure that we'll be able to make, we'll keep you updated on that. Not sure we'll be able to make those numbers, and then 10 in the fall academy as well.
So Chief, 548 applicants, but you said we're only able to get 6 of those into the Winter Academy?
Some of those will be in the academy that just graduated.
Oh,
and
okay.
They hit the streets actually this week for their field training.
Okay,
Yeah.
great. I'm sorry, did you have a question?
Councilmember Kinnear, then I'll wait.
Go ahead.
So I'm not sure, so Councilmember Stratton, you asked how many of those?
In those,
I'm not sure you understood the question. So how many women, how many minorities?
are hired.
Oh,
are
that
actually
hired.
hired.
Okay, I see what you're saying. How many of those, breaking down the demographics?
Yeah, because
how
we
many
know they're
get-
applying and all of that, but how many of them go through that process and get hired?
Okay, I'm tracking. So when you look at those numbers, the checking the box for Spokane PD is the easy part. We do have some that then don't complete their personal history form, get hired by other agencies, don't pass the physical fitness test, don't pass the background. So let me get those numbers for you.
Okay.
As far as how many we've hired. By me, I mean Director McConnell, and she is sitting in the audience as well. So we will
Okay.
get those to you.
And then follow up, I want to thank Jackie because you made a commitment early on, last year, I think it was, yeah, that you were going to work diligently to make sure that you were going to hire for diversity and look for diversity. So I really appreciate you doing that. I think it's important, so thank you for that.
And so, and I too want to thank Jackie. I do want to know, what are you doing differently that you've seen the numbers increase or not increase? I know at one point, Jackie kind of told me, your basic outreach to the universities in Montana and Idaho and the state of Washington and Oregon. So then what tools are you using to drill down or to connect with those other communities that's different than what you've done in the past?
Yeah, absolutely. Actually, I'll have Director McConnell come up
Thank you.
and explain that.
What we've found as our most successful recruiting, so it's been great to have the grant because we've been able to try some things out without it costing the city per se. And what we've identified as our most successful recruiting venues are actually going to the PSTs themselves. And we do that because, for example, there was a public safety testing, I think it was just over the weekend, and I don't remember the exact numbers, but say there was like 7 that were signed up to take the test for Spokane. The recruiter really did a good job at reaching out, talking to the folks that were coming in just to take the test in general, and he got like another 5 interested. And then he was able to actually speak to the whole group, and then an additional number signed up. So the PST testing sites themselves have been a great recruiting tool for us. And so we've used this money to expand, like going to a bunch of different PST testing site locations around the state, to diverse communities, Tri-Cities, Seattle, and just really trying to push it. And then I think maybe it's hard to say whether the social media platform, because we've been doing a social media push also, like geofencing, it's hard to tell if that's been effective or not, getting more people there, but we are getting more people to sign up.
Oh, go ahead.
And just a quick follow-up, could be wrong. I thought that we had increased not only the grants you received, but we had increased money for recruitment outreach, because I know you at one time spoke about you had going into Northern California, and I know COVID hit. Has any of that happened outside of these testing sites, Jackie, to date?
Traveling to locations outside the state for PST
Yes.
tests. We've traveled outside the state to recruit at colleges and university campuses, and I can actually pull the PST report that says the number of outside applicants that have put in. I don't know the number off the top of my head. We've received some. I don't know that we've received enough to make it worth the investment a lot of times of traveling to some of the different states.
Okay, thank you.
Two questions, and you just took both of the questions I had before already. So, but just to drill in further, when you're at these PST sites, what are you guys actually doing there? Are you talking up Spokane as a community? Do you have other officers, particularly officers of color, who are there to help kind of present kind of their experiences in Spokane, et cetera? I mean, what does that look like when you're there?
So my understanding is the different agencies can set up like a booth per se, or a table to recruit when people come to take the PST. So we have a table set up, but then as people are standing in line to sign the little roster of getting there, our recruiters are being pretty aggressive of going out and really talking up, yes, the Spokane community, the city of Spokane, the Spokane Police Department, and getting individuals who didn't initially think of applying for Spokane to go, oh, well, it's a pretty good agency, it's a pretty good city, we'll apply. And so then they apply. We've got a pretty nice brochure that we hand out. Our recruiters are pretty diverse. Also, we really try to send diverse recruiters to a lot of these events so that the community and the individuals that are applying can see the diversity of the Spokane Police Department.
That's great. My other question is incentive pay. Where are we at with the $250,000 that was allocated last year, and kind of how has that been dispersed? Has it been successful? Just kind of a general.
So I was actually going to wait until we know the exact number for sure, how many are going to get into the January Academy. It is 6 for sure. We have a potential maybe 7th. So it's either going to be 6 or 7. So once I do that, I was going to send an email. I think we've hired 8 of the 10 laterals that we had the money for. And then it would be, if it's 17 people that we hire for a new entry, it would be 17 out of the 20. So there will be some funds that are remaining.
Okay.
We were just going to kind of cut it off. So the people going into the January Academy will get that, the incentive, and then we're going to cut it off really at the end of the year for laterals, rather than say, 2 more laterals.
But if there's money left, will you continue the program then next year with the additional dollars, or does that get rolled?
There's not enough money left, so it's hard, because if we say we have 8 laterals apply next year, but in 2023 only 2 of those 8 get the incentive, that's kind of hard to. It's almost easier to just say, okay, at the end of 2022 we're going to stop that incentive. So it's going to be around $55,000 that's left of the $250,000. And to be honest with you, we haven't seen. So we have gone out and we have asked the people that we've hired, especially the entry level, did it make a difference?
Yeah.
And the reason I'm not up here advocating necessarily to get another $250,000 as an incentive, because we haven't received enough information back to say, well, yes, we absolutely chose Spokane PD because of the incentive. It kind of seemed like they were going to choose us with or without the incentive. So, I mean, we'd love another $250,000 and to continue the incentive program. I won't lie, but if I can't stand up here and tell you that we have definitively heard that it's made a difference, I can't say that. Where we do think it does make a difference is with the laterals, especially laterals that are coming in from another agency, like outside the Spokane area or another state. Because since we don't provide moving expenses, it kind of helps with their moving costs. So if we were going to continue it at all, I would say with laterals.
But I think too, the other question I would have, if we could ferret it out, is if we didn't offer that, just given that there are so many other cities that are offering incentive pay, does it put us in a difficult spot to recruit some of those officers? I think that you could maybe you argue that the incentive isn't enough, or maybe it's not the right incentive, right? That's why we're not seeing a big increase as a result of it, because other cities I think are seeing some increase, but we don't have the budget to do it anyway, so it's kind of moot at this point. But and Betsy, you said you had one more question about.
So I was just going to inquire, are there, on the recruiting team, I had the opportunity to ride along with a couple of the younger officers, and they say they would like to be part or go recruit with the more seasoned recruiters. Does that opportunity ever avail itself to take someone new who's still, very enthusiastic about coming, and for them to share that with people who are in line? Or is that just kind of a rank opportunity for seasoned officers? I don't know.
Yeah, no, I actually don't necessarily think it's out of rank. I think we really go out and we strategically look for people in our agency that we think would be really good recruiters, outgoing, diverse, know how to talk to people. They obviously have, good attitude about being a police officer, being on the Spokane Police Department. We feel that they can share about the department what we would like them to share. And so there are times when we are looking for new recruiters, and we'll send an email out and people can express an interest.
Oh, okay, thank you.
Great. Thank you guys. Any other questions, comments? No. All right. Thank you both.
I just had a question. I was wondering if you could send data that was farther back than 2021, just to kind of see the historical trend. Maybe I think the women and other one you went back to 2019. So.
Yeah, and we do have that data. So yes, we will forward
That'd
that
be
data to the
interesting.
council. Absolutely. One last piece, just to close the loop. One of the questions as well, I think, from the council president was vacancies. So as of last week, we had 14 vacancies. And mind you, that does not include the 6, hopefully 7 pending for the January Academy. We have 14 vacancies, 6 pending, 6 who've already said, it is my intent to retire on this date. And then typically what we see the first and second quarter of each year is we see a wave of retirements. And a lot of those folks don't share with us until just before they go. So if you have 14 vacancies, 6 pending, and then anticipate without knowing 10 to 15 more vacancies that we will likely see the first or second quarter of next year.
Are those 14 vacancies including higher heads or not including higher heads?
So that 14 will be reduced to 8 once we hire these 6 for the academy.
But that includes the allowance for the higher heads?
Correct.
Okay.
Yeah, correct. And then I'll just throw out the last thing when it comes to recruiting. We're a little bit behind when it comes to recruiting laterals. So like for the sheriff's office, someone who wants to live in this area, a lateral who comes from another agency can bring their time as a police officer with them. So when they join the sheriff's office, let's say they've been an officer for 15 years, they come over and they get paid at the same rate as a 15-year deputy as well. So and they also have take-home cards, which has been a big recruiting tool for the sheriff's office. So what we're trying to do is try to make ourselves more attractive for laterals as well, so that they will get their time as a police officer to count towards what their pay is when they come over as well, because we're behind the ball as an agency for that. So when you look at how long it takes to train an officer, it takes a solid 10 months. So that's 10 months of training an officer. That may or may not work out. With the laterals, they virtually all work out, and it only takes 2 to 3 months after they're hired till we can use them. So there is some savings with laterals as well, even if we can bring them up and bring them over with their years of service, so they're not starting totally from scratch.
So would that be to change that? Would that be something we would have to bargain with the guild over?
Yeah, and I don't think they're opposed to it at all.
Okay. But you think that kind of a modification would help you in recruiting?
Absolutely.
Okay.
Yeah, absolutely.
Good to know.
Councilmember Kinnear.
So you mentioned cars, and we've had this discussion. And it's my understanding there isn't really a policy that, so within the county, you can take them a car, I think, but I'm not even sure about that. So do you have a stated policy? And if so, what is it? Would you be open to looking at something that's a little bit more set, so we know that people aren't going to Idaho with Spokane police cars. So how does it work?
Yeah, typically, what we had said was, and it's evolved over time, right? I think under the former chief, it was I'm trying to remember back that far. I believe it was if you live within 30 miles of the Spokane Police Department, then if you had a take-home car, you were allowed to take it 30 miles. So that's something we can absolutely explore.
One way?
What's that?
One way.
One way, correct.
So that's 60 miles.
Yeah,
Okay, I can go a long way. 60 miles is what, Ritzville?
yeah.
That's a long way. Okay, thanks.
I have,
Go ahead.
I have a question. I'm not sure you're prepared to answer
Okay.
it, so forgive me, and you can get back to me. I got some video this weekend from a couple people who were concerned about sweeps that were taking place downtown when it
Okay.
was cold and snowing, and of the homeless that are on the sidewalks. Do we know how that happened, or what the story is behind that?
Was this in the area of Madison?
So there was one, let me think. I got two
Okay.
that somebody shot from their cars and sent.
One was in Browns,
One was in Brown's Edition,
under the bridge.
okay, and then one was on Second, and then there was one, maybe it is Madison.
Okay.
Yeah.
So the one at Madison,
Yeah.
I just got an email on that today. The officers went out and offered them services, told them, you're not going to be able to camp underneath the overpass here. You're going to have to move along. There were two individuals in that group that had warrants, so they did arrest those two for the warrants and gave the others a notice that they're going to have to move on.
Okay.
So they didn't clear the tents and they didn't enforce at that point in time.
Okay, so no personal items got thrown away, or tents, or anything like that?
Not by our officers. From what Lieutenant Braun had said is they just gave them a notice, hey, you're not going to be able to stay here. Here's some resources if you want to go to a shelter.
Okay.
And then the two that had warrants were booked.
The two with warrants, what would have happened to their stuff if they were picked up?
Typically, we would allow them to take whatever personal items they could take. And then my sense would be, and I'll get you an answer, that's a good question. My sense is that the officers are going to make sure that they make arrangements either with their friends that are there or to have their property retrieved as well. But I'll get you an answer on what happened on this
Okay.
one.
Thank you.
Absolutely.
Okay, thanks.
Thank you.
All right. Thank you, Chiefs. Chief Schaefer, and after Chief Schaefer, we will go to our community health update, so just so folks know.
Annalee, can you help me? Oh, you are. Okay, good. Do I drive then?
Yep.
Okay.
Yeah.
Just really quickly, just a slide that you've seen before. This Wednesday, we are graduating 21 new firefighters, which is a good day for us. Those people will be in the field and actually filling positions in the deployment system. Certainly going to be an assistance for the overtime. We've already made job offers for the next class. It starts right in February, and we'll graduate in 21, and then we'll be starting our 23-2 class as well in the summer of 2023. One of the things that I think police and fire share is competition is fierce. These are screenshots from other departments in Washington, which we compete against for, like you were saying, a lot of the communities are offering bonuses, hiring bonuses or incentives for people to come over either as lateral or entry level. One of the interesting things, just in the city of Seattle, on the dais, it sounds like they added another 30 to an already 60 new group of firefighters that they were adding to their budget. So they're going to be 90 positions in the Seattle Fire Department, which is going to be a really tough thing for us to compete against. But we are. And this last group in 2023 that they made employment offers to, and we were planning to start in February, it was a pretty good feather in our cap, especially since we changed the entry requirements to not require an EMT license. So I feel like we still have a lot to offer, especially with the new contract, and we're going to be pushing out a lot of that information for the second part of 2023. Just wanted to share a unique situation that occurred last week, Wednesday night. Post in Maine, in the middle of the night, we were dispatched to a wheelchair person, a person in a wheelchair that was in distress. When they arrived, it wasn't necessarily a wheelchair. It was one of those devices that propels people around, battery, very heavy. The battery had died. Normally, those batteries and those devices are able to propel people around 15 miles. So you can imagine the amount of distance that you can get and then get yourself in trouble. The officer on the vehicle or the apparatus that responded tried to make all the contacts to try to take care of this customer's problem. In traditional fashion, any time after midnight in Spokane, it's really hard to find somebody with a cargo carrying device, especially something that's capable of hauling something that heavy. We have rules, and I am sure, just like any bureaucratic organization, we have lots of rules. Some rules we have actually have past employees' names affixed to them in some fashion, and that's pretty unfortunate. And I think one of the reasons why I wanted to share this with you is because we're a values-driven organization. We have a rule that says people can't ride along with the fire department without a form getting approved. The form has 2 signatures. The person that's writing and the person that is witnessing. The person fills out the form, it goes to the company officer. Company officer approves the ride along, the battalion chief approves the ride along, and the deputy chief of operations approves the ride along. So just with all of that bureaucracy and all those rules, there's no way that we're going to be able to take care of this person's problem at midnight on a Wednesday evening in the city of Spokane. So the officers did, the fire crew did what I would expect them to do, and I think what you would expect them to do was the right thing. They attached the heavy wheelchair that was not propelled by itself. Well, let me explain it even deeper. They took the thing apart, disengaged the transmission because they can do that. That ladder truck is essentially an articulating toolbox. After they disconnected the transmission, they built a webbing system to pull it behind the tower, or behind the tillered ladder. The firefighter walked with that chair, steering it through the city streets of Spokane about a mile, and they put the customer in the back of the fire truck. Broke a number of rules and did exactly what we would expect them to do. And I'm exceptionally proud of these 4. Their names are up there and they'll certainly be recognized from us. But this occurs, this is just unique because I happened to get an email from the officer making some recommendations to us on how, if we run across this, again, how we could do it better. Because this happens a lot, and it's happening more and more where people are getting in trouble in these type of mobility devices. So we're working on that, but I think it's just a unique story, and it should be resonant in your minds too, that this happens. People are making decisions based on values daily in the city of Spokane, and all with good outcomes. So I'm pretty proud of them. I just wanted to share that with them. A number of reminders. We do, and you are all should be receiving a weekly email from us on performance in your councilmatic districts. We realign the councilmatic districts now for you, so those will be updated starting this week with that new alignment. And then we're also adding a spot in that performance for dispatch as well. The dispatch performance will look like the next slide. But I also wanted to mention every council district, 1, 2, and 3, also has a login into First Watch. So you can see live data, exactly what our performance is up to the hour, to the month, and year to date on those performance measures. If you don't remember your logon, let me know and I'll shoot it back to you. If you want to dig into that data more, you can click on any one of those speedometers and get the exact incident. So you can determine what the call was in your district, if there were any delays, and find out a little bit more in terms of call types, just not specific patient conditions. And then we are going to add this dispatch performance spot into your performance update every week. This is the one from the month of November, just a cumulative like we have done in our dispatch stats, which is exceptionally well from a performance standpoint. For priority calls, I'm moving the mouse here on the left-hand side of the slide. These are the number of incidents that were handled by the individual dispatchers and their performance for the time that they had their segment of the call, which in a cumulative is 98. And obviously our benchmarks are based on an NFPA standard. Yes, ma'am.
So is this going to include how many times paramedics are sent out to some of our homeless shelters? So we'll know just kind of what's going on out there, and it would be tracked somewhere?
I don't think that I have that much real estate on that report that we send out, but we have a separate one that tracks. I just had somebody ask that this morning for that data. We're tracking our 2 shelters with call type, time, and amount of time that we spend. So like I think the discussion this morning was the Trend Shelter, we've got it down to I think 11,000 minutes that we've been there, time on task, and then the number of incidents that represents. I could share that with you just in a spreadsheet.
I'm just thinking of what would be helpful, because we're starting to hear too that people, with the some of the diseases and the sicknesses that are going on in the shelters, people wanting to know, how many people are being treated, or I just don't know.
Yeah,
the
I don't know
best
if
way
I
to
can
get
automate that, but let me see if I can. I mean, we certainly have a disease surveillance system with Intera that we're watching. We have a connection with the epidemiologist over at Department of Health. So we're watching as diseases progress across town, especially in our adult homes and the nursing homes and the skilled nursing. All of those are on a geographical illustration.
Okay.
It's kind of like GIS. We watch that really specifically. But if you have any ideas on how you'd like to see the data, I could probably
Yeah, I
put
was
something
just
together.
thinking in some of these conversations that if we have a large amount of paramedics and the fire department going to these shelters, then maybe we talk about figuring out when it's time to have a medical person on site is just one of my questions.
Okay.
Like at Trent.
Michael,
Yeah, go ahead.
I'm sorry.
along those lines, we have heard that fire is not responding to Trent, so.
I heard that rumor too, but that's not true. What we're doing is we're tiered response. We have a tiered response system. BLS calls get AMR on BLS calls, and ALS calls get AMR and fire, the fire department paramedics. So at 4320 at the Trent Shelter, they only get AMR, and for emergency calls, they get fire as well. There are a lot of calls both to the Trent Shelter and to the House.
House of Charity.
Help me out here.
Camp Hope.
Camp Hope, thank you. But we're not able to just send AMR to Camp Hope because of the level of risk for the responders. So we still send fire for protection. But on those low acuity calls, we certainly don't need fire at those. Most of them are transports.
Did you just say protection?
I did, right. So we've had a number of threats to our responders going to Camp Hope. We've been approached with machetes and large knives, an axe. The other day I was approached with an axe, took a picture of the person. So it's legitimately a risk for responders to go to that camp.
And why wouldn't police accompany fire? I mean,
If they're available, they will. But I mean, just like the other day, the police system, the law enforcement system, and that need, and the resources that we have in the system to meet that need, it only takes one or two emergencies, and we're pretty well tapped. And I can't speak for police, but just from my own perspective, when we go to an EMS call, we've reinforced that response so that we have at least 5 people there, just for the protection of the responders. During the day, there's a police officer that will accompany us, but we can't guarantee at night that we're going to have any support. So we work with the security people. They try to bring the patient out to us, and we do everything we can not to go into that camp unaccompanied by PD.
It would be really helpful if we had access to state patrol from the state, because that would provide another avenue to provide that protection. So I think it'd be really helpful to have data on responses, and this would be police and fire, to all of our homeless shelters and the camp and all of that, because I think it's important that we are able to accurately calculate the exact cost, because I think the public should know, but also I think that can help us to think about alternative ways that perhaps you could respond that might reduce the cost. And Councilman Stratton mentioned, maybe a medical person on site. I don't know if that would be, way too expensive or a lot less relative to what we're doing now. So it'd be really good just to have that data so we could kind of think about all those different pieces.
Yeah, we've done that. We've experimented with that in the past with House of Charity. If you recall, probably 8 to 10 years ago, there was a clinic actually put inside of House of Charity, and a very huge need from the fire department in terms of responses. And that really wasn't very successful because the transport is what was needed, that higher level of care. However, around the corner, they put a clinic, an urgent care from Providence into the building, which was a walk across the street, essentially, to care. And that has really reduced our level of responses to House of Charity. So you really have to have that viewpoint of what the needs are and what the types of calls on the aggregate are, and spend a lot of time with researching to determine what best fits for the situation that you have.
Just
Yeah,
one
go ahead.
quick follow-up. So I was at the Homeless Coalition meeting last Thursday. That's where a lot of providers get up and give just updates on what they're doing out in the community regarding homeless and sheltering. And the Salvation Army reported that an individual had died that morning. Is that something then that fire responds to, or how does that get handled? Because I don't think we heard about it here. And-
Right. So it was a witness cardiac arrest. I was there, and we had probably a half an hour long resuscitation attempt on the gentleman that passed away. The cardiac event, we were not able to reverse the process, but it was the result probably of a number of different comorbidities that the patient had.
Okay.
We remained there. I think I called the time of death at 7:06, and the police department came, and we handled it like we would do in any other out-of-hospital
Okay.
death. We've had the same incidents happen at Camp Hope, House of Charity, everywhere. People unfortunately pass away in just about every conceivable location. So.
Okay.
But that was the background there. It was wife witnessed a cardiac arrest.
And that was another, if I could, more rumors that that person had, that rigor mortis had set in and that person
No,
was.
my gosh,
There
no.
we go.
No, in fact, I even listened to the 911 call. They did great. And the dispatch and the person that they were conveying the compressions did absolutely wonderful. Our medical director actually went through the call too. It was,
Thank you.
some of those, I mean, I'm pretty proud of our resuscitation statistics. I think we've got some of the best across the country, but there are instances, regardless of the medications that you have, regardless of the skills of the paramedics, they just don't respond to the therapy that we use. So we did our best, and unfortunately it was a bad outcome.
Councilmember Beaton?
Yeah. Hey, Chief, how are you?
Good.
Yeah. So there are a number of rumors that we hear, a number of emails and things like that we receive, and rarely do they put the city in a good light. And so, what would your advice be to us when we receive those rumors? How can we dispel them if necessary, or because pretty quickly rumors get spread, and then it becomes what actually has happened in the perception of the community's mind. So, do you have any advice for us on that?
I get the same. I'm in the same situation. I try to get as much eyes on the situations as I possibly can. I'm in the homeless shelters. I make it a point at least once a day to be in them, to understand them. But from an empathy standpoint, I think it's important for all of us to really consider other people's viewpoints and how they view a situation, just like the person that passed away. But you can't dispute the facts. You can't dispute the data. So like you're asking for, ask for that data and exactly what question you're looking to solve, and we'll try to get that to you. So wrong terminology, but so you're armed with good information. And then, you know, I think it's important for us to understand that many of these situations are complex, and it's tough to talk about, but talking through it with data just makes it a little bit easier. That would be my recommendation.
Okay. That's it.
Nope, okay.
Thank you very much, Chief. We really appreciate it. And we're going to move on and get an update from the Regional Health District. And this is actually a good segue because it's really focused on some of the outbreaks and issues that we've seen at some of our shelters. And so appreciate you being here to present and chat with us a little bit about what's been going on.
Sounds good. Thank you. Mark Springer, Communicable Disease Manager at the Spokane Regional Health District. So what I have here is just a couple of slides to look at what's happening in our community in terms of respiratory illness and some of the outbreaks we're seeing. What you're seeing here is our data from wastewater testing for COVID. And COVID-19 is really challenging to get good data on nowadays because people are not getting tested, or they're getting tested with using over-the-counter tests. And so this is really the best system that we could hope for because it gives us a good picture of what's happening in our community, regardless if anyone gets tested at all. So it's a really good reflection of what we have. And you can see one of those lines, you know, in blue looks at our COVID numbers, and the one in yellow, which is more difficult to see, is our hospitalization rate. So you can see how well it tracks with that. So it gives us a really good predictor of what we're going to see. What we're seeing here is typical of what we're seeing across the state, which is a little bit of an increase in COVID activity. You know, this is not unexpected. COVID has shown us, you know, a series of different variants, you know, with increased transmission. And what we're seeing across the country is a new variant or a new set of variants, the BQ variants that have a little bit more immune escape for people who are vaccinated or who have past infections. We haven't seen that to a large extent in our community yet. But that gives us a little bit of idea what we're potentially going to see over the next couple of months. What I have here is one of our other respiratory illnesses, and this is influenza, showing some of our activity to date for hospitalizations compared to past years. And hospitalization data is really our best measure because, again, you know, this is something that's not really dependent on widespread community testing or people going in to see a healthcare provider. Generally, people who are hospitalized are going to get tested at a pretty good frequency. And what we're seeing this year is just an early flu season. That's all we can say right now. We don't know if it's going to be an especially worse flu season compared to past years, but we do know it's early. And so as I look at these two with the COVID data and then with influenza, this kind of paints a picture of, you know, a little bit of our risk, you know, going into the next couple of months. Because we've seen a lot of RSV activity with kids, and that's put a lot of pressure on our hospitals. We're seeing some influenza activity, but, you know, as we can see here, that what we have right now is nowhere near the peak of a typical flu season. And so we can see some potential for increased utilization of our hospitals with influenza over the next couple of months, and potentially what happens with COVID with these new variants. So we could see a little bit more pressure, you know, on our hospital system. And then just looking at across the community, I know there's an interest in what's happening in different sectors. So long-term care, skilled nursing, and adult family homes, in that sector, we do have a fair amount of activity here. This isn't representative of an increasing problem. This is just kind of a baseline activity. Long-term care settings or settings where there's a lot of testing for COVID or for flu. Surveillance is really good. That's a population that's more at risk. And so what we're seeing here is representative of what we would expect to see. In other settings in the education arena, most of what we've seen has kind of hit the younger kids, with RSV activity, with childcare settings, and with schools. Kind of our outbreak data nowadays with COVID is a little bit different. Outbreaks are only reported with 5 or more cases in a classroom. And so we expect to see fewer outbreaks because the measures that we have this year are not the same that we had last year. But we are seeing something that's different, and that's higher absenteeism in schools, and that kind of reflects the picture of RSV, flu, and potentially COVID. And so we do see some schools that are hitting high absenteeism rates of over 10%. The other thing that I wanted to just address there is shelters and congregate settings. This is an area that we've seen some activity with. COVID has been fairly mild in shelter settings. We do have a couple of shelters that are kind of working their way through small outbreaks, and they're moving through that. But we are seeing some influenza activity in more shelters and congregate settings. And we've had some reports of gastroenteritis, which is, kind of what we would typically think about as the stomach flu. Abdominal pain, maybe some diarrhea, some vomiting. We typically think of that as kind of the hallmark signs of norovirus, but we haven't had that diagnosed in any of those settings yet in terms of with the laboratory test. Right now, those numbers are smaller numbers in terms of the gastroenteritis, but it is something that we're actively working with shelters and doing consultations in terms of how they can improve their mitigation measures and can work on what needs to be put in place in terms of sanitation. I think those are all of my slides. I'm happy to entertain any questions.
Thank you very much for your presentation. So in education, you said if an outbreak was if they had 5 or more in the same classroom. Was that correct?
Correct.
And then in the congregate setting, is it the same metric, 5 or more cases in that shelter, or would it be a different metric?
It's a slightly different metric. When we've looked at COVID in those settings, we've usually looked at 2 in a 28-day period. So it's a fairly aggressive approach to looking at identifying outbreaks and putting in those mitigation measures. When we look at influenza and norovirus or gastroenteritis, we look at different thresholds. I mean, we still look at small numbers to identify an outbreak, but where our concern is really focus on larger percentages of people being ill. Because if we look at a shelter that has 100 people and we have 2 people who are ill with gastroenteritis, that's not unexpected, because that's kind of typical of what we might see in other areas of the community. So while it's a concern and it gives us some information that we can provide to the shelter, the congregate setting, so that they can put measures in place and they can start looking at trends, it is not a house on fire type of an event. Mm-hmm. It is a kind of a signal type of an event that lets us know something's going on, and that's really the best time to respond, is when we have, some reports of some illness present, and at that point we can put in mitigation measures that can hopefully prevent additional illness.
Okay, thank you.
Do we, is there another question? Do we know kind of what the percentage is, and it's fairly generic, but what the percentage is of like the homeless population that have been vaccinated for COVID-19? And does that affect at all how you address it in a shelter setting?
Yeah, that's a difficult number to get. At one point, last year, we did have fairly good numbers for that, because what we would do is we would get rosters of people who are in the shelters. We would look up their vaccination status, and then we would be able to get a measure of the vaccination status of each shelter, and then that would allow us to prioritize different people for their booster shots. And at that point, our vaccination rates were kind of in the 40 to 60% range. We've done a really good job in terms of that population, but we can't say that that's the same now from 6 months ago, because with winter weather you get different people coming in, and so it's a different population almost.
Changing population. One more really quick question I see.
Sure.
Wastewater testing. Do we only test for like COVID, flu, or are there a myriad of things that we test for that maybe just kind of weren't?
Right now it is just COVID. The state had put into place monkeypox testing earlier on, and right now that's not showing any activity, any significant activity across the state. It is a platform that once it's set up, with the sampling and everything else, if there is a desire to put testing for another disease agent, another virus, it's fair. I don't want to say it's easy to do, but the system is in place, and then that can be put in place, I think, within about 6 months if that's prioritized.
So I don't know what the cost associated with doing wastewater testing is. Maybe it's a high cost, but do we ever just kind of do random tests for things just to kind of get a check-in and see? And I know that there's data as to why they're doing it, but I know there's 2 cities back east that are now testing for polio because they know their polio numbers are down, their vaccine-related numbers are down. So I'm just kind of curious, do we ever check on other things?
It's a longer process to be able to set up that, because you have to do a long series of quality assurance testing to be able to look at the signal that you're getting is representative of a certain level of disease activity. Polio is certainly one of those things that's been looked at on the East Coast, where they've seen some evidence there. There's also been some conversations about looking at non-infectious agents, like looking at opiates or something like that in wastewater, to get a community perspective of that. So it's a great tool, and I think it's going to be utilized in a number of different areas in the future.
Okay, thank you.
Just a quick one. So as you probably guessed, that we get a lot of calls on all sorts of different issues, and lately we've been getting calls about communicable diseases in shelters and that kind of thing. Who is the correct person if we have questions or we want to direct somebody to the Regional Health District? Is it you, or is there somebody else that you recommend we use to kind of get questions?
I would say probably the best person to direct that to would be me, and then there's a couple people within my team, depending on the question that it would get triaged to.
Okay. And then do you, I'll get your information.
Sure.
Okay, thank you.
Yep.
Last question was, you had mentioned gastroenteritis and linking it sort of to the norovirus. These are things we typically look for. I've heard that it's been difficult for us to test to see if it's actually norovirus because of the waste facilities at the Resource and Assistance Center, the TRAC. Is that correct?
It's the challenge with testing for that is you have to get a stool sample.
Right.
And so it's not something that you can just, have the provider do a swab, like a nasal swab for flu, with that person right there. So it is doable in a shelter setting. It is just challenging to, within the context of the providers there, to have that done and then to get that back in the period of time where they need to pick up the sample. Where we most often get the testing done is with our hospital emergency departments. And so when we had this first report, and I think the first report came to us from fire, is we contacted our local emergency departments with Deaconess and with Sacred Heart, and just alerted them to that we were seeing the gastroenteritis, and asked them if they do have people who are coming from shelter settings who have GI symptoms to test for norovirus. And oftentimes that's the easiest route for us to get the testing. And all we need is 1 or 2 to let us know that it's there. And then we apply just a case definition to anyone else who has similar symptoms. And we assume it's norovirus unless proven otherwise.
Okay.
Yeah.
Anything else? Okay, thank you so much for the presentation.
Okay, thank you.
Appreciate it.
Thank you.
Okay, and I do hope that we can have next year, my goal is quarterly, maybe get an update from either Dr. Velasquez or somebody else at the Health District. I think that will be helpful to add to our committee. Okay, so next up, we have, let's see, unallocated reserve balance ordinance. So this is very, very simple. I'll share this as an ordinance I'm sponsoring and Betsy's co-sponsoring with me. That would essentially require that we build back up our reserves. So over the course of, well, since my time here, you know, our reserves were pretty high. I mean, they were, I think, over 20% at one point, including our unallocated reserves. And just, I mean, a lot of expenses. We've had COVID. We've had a number of things that have affected city government. And that has kind of slowly trickled down. And so there's still some conversation, I think, over maybe the exact right number, but from what I have seen and heard so far, that number seems to be 25%, and so that's what we've put in here that it should get to. And so the idea of this ordinance, very simply, is it would require that over 5 years we build that reserves back up to 25%. There is an allowance made if we see a dip, you know, an economic dip, so sales tax goes down, for example, that would sort of allow us to put a pause on that, because that's obviously the point of having our reserves, is to help with those, and we don't want to make it worse. I know the administration has had a couple of things they've suggested, so still looking and thinking about those. This won't affect this year's budget. It really would be more effectual to next year's, just given timing and everything else. And so the other reason for trying to get this back up to 25% too is just in concern to want to preserve our bond rating. And so what we've been told is that, you know, the fact that we have reduced our reserves sort of creates a story in and of itself. And what we need to be able to do is to go back to those rating agencies and share the story of how we're going to build them back. And so that's really the goal of this, is to have that ability to go back to them and explain to them, hey, yes, it's gone down. We're going to take them back up. Here's how we're going to do it. Here's the timeline. Provide reassurance and confidence to them. And so that's really the purpose of this ordinance. I've got one other that I'll be bringing forward as well, possibly not till January, because again, it would affect next year's. And that one specifically would require that while we do a one-year budget, the idea is it must balance over 2 years based on projections for both spending and revenues. So that one, that's not on our agenda today, but I'll just mention that it's one I'm working on that will be coming forward soon. So if there's questions, or if Betsy, if you have any comments?
I was just going to, thank you, Councilmember, just comment that we have an excellent bond rating. If we lose our excellent bond rating, it would be a Herculean effort to get our ratings back up over a period of time, and it would cost us money. And so that is the whole, is to protect where we are and to plan for the future. And we've talked about how do we restore those reserves. And we know it's all critical, as it is with personal accounts at your dinner table. So we're going to move forward on that. Not saying that the administration hasn't done their job, but we have to be extremely intentional of how we protect the city's ratings and how we have money in reserve for things that are not planned for and things that are planned for. Councilmember Kinnear.
Thank you for doing that.
Yes.
It's not just about all that you've said, but it's also an indicator of if people want to invest in our community from outside the
Yes.
area. And we do want people to do that. So with a good bond rating, that is something that they will look at as well. We are, as a council, ultimately in charge of the budget. So it is our responsibility to take that seriously. So I appreciate both of those things that you've brought forward. I think they're very much needed. And going forward, I think it will help other councils, because before Gavin came in and talked with us, we were kind of like, yeah, bond rating. But as soon as we heard from him how hard it was to get to that point, how easy it is to lose it, and how difficult it is to get it back, I don't think any of us was really aware, and that we do need to take this seriously. So thank you both for doing that.
Absolutely. Anything, Councilmember?
Quick question, would this one affect the 2023 budget, or would this start in '24?
It would it would affect 24. Yeah.
24,
So,
so
not
next year's budget.
because we're
Okay.
passing that
Right,
this year.
right.
So it'd be the next year's budget.
Okay.
Yeah, the next budget we do. Anything else on this? Okay.
I'll just note that that is on for suspension of the rules today to add as a first reading ordinance.
Briefing.
But it would be a first reading ordinance tonight.
So
if you
final
add it
reading
at
would
briefing.
be next Monday.
Would be next Monday, yep.
Yeah, yeah. And so, and just on that note too, if the administration has any other just thoughts, and I know Tanya was going to send me some stuff on that, send it our way as soon as you can. And then our last one here is ARPA SBO discussion, and I don't know who's.
Mr.
We have
Boston's
Matt- we
going
have
to come
Matt here.
down.
All right.
Sorry, so there's a couple of different versions that are floating around about this. This is essentially the allocation of the remainder of the ARPA funds. We talked about it briefly at study, well, we didn't talk about it briefly. We talked about it at length during study session last Thursday. The most current version is showing $4 million for back due balances to the utility fund, $2.5 million for homelessness, $150,000 for broadband infrastructure, and $150,000 for ADU reimbursements for the ordinance that was already passed last November. There is some subject to change based on the homelessness allocation that's there right now, based on increased commerce funding allocation that has been made on Friday of last week, as well as the projections that we had for the utility tax that we are going to be receiving in 2023 based on the $4 million that is going for utility customers. That is actually not going to be captured in 2023. I've talked to some of the council members individually on that. That is actually captured when the funds, or when the bill is actually charged to the customer, not when the bill is when the bill is received back from the customer in terms of their payment. So we're going to have to adjust things around a little bit. We're in discussions with the budget committee right now, as well as the ARPA subcommittee. So we'll have some answers for you soon on that one. So the 2.5 is the one that's subject to change, just so everybody knows.
When will we kind of have more of a firm decision on that?
Well, between conversations with the Budget Committee and the ARPA Committee today and tomorrow, I hope no later than tomorrow afternoon.
Okay. Anything else on this?
I think ideally we'd be trying to add that for the 12th if possible. Originally there was some talk about adding it for today, but doesn't sound like that's possible. So,
And
yeah.
do we have, this is our last item, so we'll be done after this, but do we have a tentative plan for the 19th if there is an absolute necessity for it for some reason?
We have not officially canceled the meeting on the 19th yet, so we'll hold that until we've wrapped up the budget or,
Just as a.
But we have communicated, the clerk's office mainly has communicated that nothing should be filed in on-base for the 19th, and we will not be having finance committee. So I'll do that committee cancellation later this week.
In years past, if the budget was vetoed by the mayor.
You're kind of far from the mic. We can't.
If the mayor vetoed or if something went wrong, that usually was the only thing.
Okay.
So you just come in and you vote on one thing and then
Do
poof,
that.
you're off to your cocktail party.
I don't have any of those planned. But, okay.
I have one question.
Yes.
Who's having a cocktail party on a Monday night, the week of Christmas?
Everybody.
Lori.
Everybody.
You're just not invited.
I haven't gotten my invite yet, I guess. My
I guess
lord.
we're all invited to Lori's. Okay.
I would say BYOB.
Okay, with that, our meeting is adjourned, and we'll see everybody back actually in February for public safety. There will not be a public safety meeting in January.
And 3:30.